Okay, so Nanavati Hospital is one of the oldest hospitals of the city of Mumbai. I mean, on the northern side of the city of Mumbai, we were inaugurated 65 years back. The initial brick of the hospital was laid by Mahatma Gandhi. The first patient which came in the hospital was by the blessings of Mahatma Gandhi. After that, Mother Teresa has blessed this place and she has helped us inaugurate the new cancer block almost 20 years back, 25 years back. We have been on the forefront of medical education and medical technology at all these points in time. Last 65 years, we have always provided healthcare across Mumbai and beyond. Nanavati has been at the forefront of latest advancements in technology across various disciplines in the Western India as well. So it's one of the most premier institutions which carries a legacy of treating thousands and thousands of millions of patients for the entire region. 3.5 years back, Nanavati had an understanding for operations and management with a private limited company, Radiant Lifecare, who gave their expertise to manage this hospital in a completely professional manner. So, with the involvement of a professional management team, Nanavati, which was into certain kind of financial downtrend, has again come back. We were in losses and now we have turned around ourselves. We are doing good work. Our entire infrastructure has changed, the entire skill sets have changed, and I think we are doing much better than what any corporate hospital in this part of the country would do. See, hospital is a very complex environment, so it's very technologically intensive and labor intensive at the same time. So right from having the support services staff to the super consultant, and right from having a very basic equipment like a normal bedside locker to a most advanced microscope or a cath lab or a CT scan and an MRI. So we deal with a plethora of technology, we deal with the entire spectrum of manpower. And to manage this and to ensure that the best care is given to patient is what ultimately our aim is. See, nobody loves to come to a hospital. It's never a welcome place. You don't have a welcome sign in front of the hospital. People come here because they have to make sure that they're fit and fine. And in situations where they are sick and they're not well, we are the place where we can take care of them and send them back home. So our entire intent is with respect to the patient care as well as our outcomes. So at Nanavati, as a part of management, we realized that we need to have a complete structured approach with respect to clinical administration, nursing administration, the financial administration. So we developed an entire structure of management staff across the length and breadth of the hospital, right from having a system in place where we have patients, we have people to help for patients who have insurance. So we have a specialized insurance desk. We have also registered with charity commissioners, indigent patient fund, where we treat almost 2% of our, we have reserved almost 10% of our beds for indigent and weaker sections of the patients. So we do a lot of charitable work as well. On the management side, we had to completely revamp the entire organization structure, bring systems and processes in place to improve the efficiency and improve the effectiveness of the whole functioning. So I think overall, we have tried to infuse a sense of structure in the entire functioning of this place. We have made it process dependent than a person dependent. See, what we stand out for is our patient care and our excellence with respect to patient outcome. We are very, very focused and passionate about the outcomes of a patient. Why a patient comes to a hospital? He comes basically to ensure that his disease or infirmity, as we call it, needs to be rectified and cured. Our objective is very clearly focused at patient's outcome. So we have very systematic way of tracking the clinical quality indicators associated with the hospital and in general with the overall patient care. And that is where we make every possible effort to have a complete diametric shift towards improving our patient care. And that concern, we are going ahead with a lot of quality accreditations. We had NABH earlier in the past. Now recently we've got NABH, NABL certification for our entire lab services. We have received our NABH Nursing Excellence Award just recently, and we are in process of getting a NABH recertification. Before we go on to, of course, the JCI, which is the International Quality Certification. See, we are a multi-speciality tertiary care setup. We have almost 55 specialties in healthcare. We intend to focus on certain niche areas and create center of excellences in areas like neurosciences, areas like cardiac sciences, in areas like spine, orthopedics, oncology services, pediatrics, and organ transplant. So we are very focused, and we want to have a complete paradigm shift with respect to the way we handle organ transplants. We have initiated activities with respect to kidney transplants, liver transplants, and we are also recently introduced bone marrow transplants. We have a very well managed 6-bedded bone marrow transplant unit at Nanavati Hospital, and one of our sister concern hospitals, BL Kapoor Hospital in Delhi, is one of the largest bone marrow transplant center outside North America. So we have a huge clinical base of handling such complex situations, such complex therapies at Nanavati Hospital. Any hospital, for that matter, is a social place where people and public come for their use. At Nanavati, what we have done is we've tried to also continuously keep a connect with the local community whom we address. It could be within a 5-kilometer radius, or it could be within a 50-kilometer or a 500-kilometer radius. We have created smaller groups. We have a program called 360 at 60, which is for the senior citizen members of the society, and we call them to the hospital, show them a lot of initiatives, innovative things, ensure that how they can take care of their own health, and we give them a lot of health tips. And it's also a program where they feel nice in a very nice auditorium which we have, and a lot of healthcare programs we show to them. We also take care of school health activities with respect to schools around us. We also do certain outreach programs with respect to areas which are around 300-500 kilometers from the hospital, with respect to niche areas like I said, bone marrow transplants, or higher-end neurosurgeries, or spine surgeries, or joint replacements. So it's a niche activity which we are promoting. Passion for healing is our clear thought process and clear vision, and being a service differentiator with respect to patient outcomes is what we aim at. We want to take healthcare to the next level. We want to actually raise the bar of healthcare in this part of the country. So an interesting case which I can remember of is very recently we had a young patient whose entire hip joint was fired, and it was completely locked, and he was almost bedridden for a few years, and he had visited a lot of hospitals in the past, and he came and met our joint replacement director, Dr. Bhosle, and post his successful surgery, it was very happy to see him ride his bike again and come and meet him for the follow-up. Something like a medical miracle, so to say. Three things in Nanavati which we don't compromise is transparency of our communication, transparency in our billing, and patient safety. So very clearly we do not compromise on our standards in these three areas. See, Nanavati is a charitable trust hospital, so we are registered under the Charity Commissioner of Mumbai, and as a part of it, we do charity for indigent and weaker section patients, and we have dedicated beds reserved for them. Eat healthy, exercise every day, drink healthy, take care of your own body and own self, and please buy any health insurance. Find, connect, follow us on Medicalwale.com, आपके हेल्थ के साथी.